Welcome to the Telehealth Certification Institute. This webinar is to explain to you the telemental health rule that Georgia has come out with recently. So the Georgia Board, the Georgia Composite Board of licensed professional counselors, marriage and family therapists, and social workers passed the telemental health rule on September 11th, 2015. And this rule went into effect on October 7th of 2015. They've been working on this rule for some years and have been very carefully developing it to the point where it passed. And there's a lot of questions about the rule. What does the rule mean? Why do we have the rule? And as like myself and a lot of others, we've submitted several questions to the board, and we now have answers to those questions. So I'm going to explain to you what the rule is, why we have it, and hopefully fill in a lot of blanks in terms of the questions you might have about the rule. But to begin, I think it's important to talk about licensure. This addresses why is it that we have this telemental health rule. Well, your counseling license or marriage and family therapy license or social work license, the whole reason why the state of Georgia has a license for those professions is to protect the residents of Georgia. That's the whole purpose, right? So that people in Georgia who want mental health treatment, they know that they can go to a licensed professional, licensed by the state, and be assured that this professional has at least received a master's degree, right? They at least have taken an exam to show a certain level of competence. They received a certain amount of supervision, again, to show competence. So by having the license, it adds protection for the residents of the state. And it also adds that protection because there's someone to complain to. There's a process that kind of regulates and safeguards that license. So if someone is not having a good experience with a therapist, they could complain to the board, and the board could suspend that license. So in that way, when someone's looking for therapy and they find a licensed therapist, again, they could rest assured that that therapist probably meets a level of competence. Otherwise, they wouldn't have a license. So what does that have to do with the telemental health rule? Well, the rule, again, is to give us some guidance around competence so that we are competent in providing mental health services via the use of technology in a way that protects our clients. When we use technology with clients, there's a lot we ought to take into consideration in order to protect our clients' confidentiality. If you have clients' information going through the web with the use of using video conferencing or even phone or email or texting or electronic health record systems, any of that kind of stuff, faxes, it poses a risk to our clients' confidentiality. Now, there's nothing new in terms of our obligation to be competent in the use of technology. In all of the Code of Ethics, it's been there for a long time, states that if a clinician is going to be using technology in their practice, they ought to be competent in doing so, right? We ought to have safeguards. We ought to be using encryption and securing our clients' information. We ought to receive additional training and education to make sure that we're competent in the use of technology. We also have HIPAA law, which we are regulated by. The problem is that most clinicians, as of now anyway, are not compliant with those ethical guidelines, our codes of ethics, and HIPAA law. So the state of Georgia recognizes that and is encouraging setting the standard that clinicians receive adequate training, again, to be competent in use of this technology. So let's review this. Let's review the rule itself, and I will show that to you. Let me do a screen share for a minute with you. All right. So here we go. So you ought to see the screen. And let me go to the Composite Board's website. If you go to the Composite Board's website and you go to Rules and Regulations, then you will see the Telemental Health Rule. And again, it states the purpose. The purpose of the rule is to define telemental health. What is it in the first place? And to establish minimum standards to the delivery of services by a licensed professional counselor, social worker, marriage and family therapist using technology-assisted media. And then, what does that mean, using technology-assisted media? And the rule goes on to explain what that means. The rule gives a lot of definitions, such as asynchronous store and forward. That simply means communicating in a way where you store information and then you forward it to someone for them to review, such as email, texting, sending recordings, sending images, and so forth. They talk about the distant site. Distant site is the location where the services are being delivered by the clinician, right? And then it talks about telemental health itself. What is telemental health? Is doing scheduling telemental health? Is having an actual counseling session via, say, video conferencing telemental health? What is it? So the rule explains what that is. It means the mode of delivering services via technology-assisted media. And again, that is using the phone, video conferencing, the internet, smartphone, tablet, computer, any technology, right, defines telemental health. And as we go through the questions that people have submitted, we're going to clarify that even more. Now, you have clinicians that are providing services through electronic means. And part of knowing that clinicians are competent in the use of technology or in providing services at all is the fact that they receive supervision, right, from seasoned clinicians that help mentor and further train clinicians to get to the point where they're fully competent. That's the supervision piece. So therefore, if clinicians are using technology, supervisors ought to be competent not only in using technology, but also in supervising clinicians who are using it. So if clinicians are required to have training, of course supervisors also need to be trained adequately to be able to provide that supervision. So there's a definition of telemental health supervision. And again, it's the means the delivery of supervision via technology-assisted media. That is what we call telesupervision, providing supervision from a distance or using technology to provide supervision, such as your supervisee bringing recordings in. So the reason why it's important for supervisors to be trained is not just so that they are able to provide supervision from a distance, and we'll get more into that, but also so that they could supervise clinicians who are providing services in that manner. All right. So what does the rule require? That's the provisions. So for clinicians, the requirement is 6 hours of continuing education training in telemental health. And so when you look for training, again, you want to make sure that it's specifically about telemental health services. Telemental health is called many, many different things. Web-based counseling, online counseling, virtual counseling, technology-assisted counseling or therapy, all sorts of different definitions, distance counseling. But you want to make sure the training specifically is about that. And the folks that train you, it's their job to create a training that's really going to allow you to be competent in the use of technology. Now, when you take a training, you want to take a training that specifically is going to address those methodologies, those mediums of communication that you specifically use within your practice. Remember, that's what's important, protecting your client. So whatever ways that you're using technology, you ought to be competent in that and protecting the client's information and using that technology. So it's not that one training is a fit for everyone, right? It's specific to how you're using technology in your practice. And that's my viewpoint. That's not here in the rule. But let's go over exactly what the rule says. Now, in this provision, around the 6 hours of training, they list some of the items, some of the aspects of telemental health services that's important to look at. But in regards to choosing a training, the requirement is 6 hours. So all of these components here, 1 through, let's see here, 8, you don't have to have all these components in that training. As it says here in the rule, may include but not limited to the following. And it lists a bunch of different aspects, well, 8 of them, that go along with telemental health services. And if you've already taken a training within the past 5 years, you don't have to repeat that. You're covered if you've taken 6 hours of training already within the past 5 years. And then in regards to supervision, right, it talks about the rules and regulations around providing supervision. And supervisors are required to take 9 hours of training, 6 of them in telemental health therapy, just like every other clinician, right? They ought to be competent themselves if they're going to be supervising others around the use of technology. But then also an additional 3 hours on supervising telemental health therapy. As you'll see, a lot goes into that. It's not just being competent in the use of technology as a clinician, but knowing how to supervise. Because in supervising, you are going to be looking at the scope of the supervisory relationship. You're going to be looking at how is it that you actually evaluate whether or not a supervisee is competent in using technology within their practice. What suggestions do you make? How do you make sure that their services are efficient and effective? And the supervisor's primary concern is the safety of the client. So how is it that you do that, the assessing, the monitoring, and development of a supervisee in the use of technology? And then it talks about informed consent and client assessment, codes of ethics, the scope of practice. Let me point out here the scope of practice. This rule does not change the scope of practice of counselors or social workers or marriage and family therapists. We have been able to provide telemental health therapy. We've been allowed to do that. This rule doesn't say that we can or can't. What this rule says is, listen, the standard is if you do provide services through electronic means, you ought to be competent. And part of being competent, one way to verify that is that you've at least taken 6 hours of training. So that's what this rule does. And then it mentions if you're working with out-of-state clients, of course you have to look at state law, wherever it is that the client physically is while you're providing services. And then it talks about the continuing education that you have to have within those 2-hour cycles to renew your license. And the 6 hours is part of the 35. It's not in addition to the 35. It's part of those 35 hours. So that's the telemental health rule in Georgia. Now, if you're like me and a lot of others, you probably have a lot of questions about the interpretation of this rule and why the rule came about. I've talked to you a bit about why the rule came about. Let's look at particular questions that have come up around this rule. And to do that, we go to the web page on facts and telemental health rule, general guidelines. And let me cover some of the things here in the questions and answers that were posted by the state board, which has been extremely helpful for us. So one question is, when do I have to have completed these hours? A lot of us have that question, right? Does it have to be by October 7th when the rule went effective? Does it have to be by when I renew my license? So the composite board is saying that as long as you complete these hours by the next renewal period, which is September 30th, 2016, that's fine. It shows that you have made effort to complete following through with this new standard. And another question is, do I have to get these 6 hours if I don't practice telemental health therapy at all? The only thing I do is schedule clients over the phone. Clients call me, they want an appointment, and I schedule them over the phone, just like we've been doing back in the 1800s, right? We've always been doing that. Do I still have to get those 6 hours of training? No, you don't. Scheduling and canceling appointments is not considered part of telemental health counseling. However, providing clinical services via technology is. What about crisis calls? Is that part of clinical services via technology? If a client's having a crisis and I talk to them over the phone? Yes. If you're taking crisis calls over the phone, and I'm not sure how you would avoid doing that as a clinician, to be honest with you. I suppose there's ways you could refer them elsewhere. I'm not sure that's really providing the best care. But if you take crisis calls, then yes, you are required to have those 6 hours of training. What if I use computer programs or like apps on phones and so forth in order to interact with clients? Yes, you need the training. What if I'm licensed, say, in Texas or New York or California? Say I'm licensed in another state and I provide telemental health counseling or therapy in those states. But I'm also licensed in Georgia. Do I need those hours? Yes, you still need those hours, even though you're practicing in another state, because you are still licensed here in Georgia, and this is about your license in Georgia, and you are practicing in that way, so yes, you need those hours. All right. Again, I talked about what kind of training to look for. You want to look for training that specifically is about video-based counseling, technology-assisted counseling, and so forth. And then it says, do I have to meet all those components or aspects listed in the rule in my training? You don't. Like I mentioned, what the rule says, it says may contain but not limited to all those aspects. Remember those 8 aspects listed in the rule. All right. So what if the training I take, that I take also includes ethics hours, right? Like here at the Telemental Health Institute, our essentials course, the course that's specifically designed to meet the telemental health rule, is actually 7.5 hours long, and 2 of those are specifically on ethics. So the question is, can I also attribute those ethics hours towards my ethics requirement? So if I take a course that includes telemental health counseling hours and ethics hours, can I both cover the ethics and the telemental health counseling? You can. You certainly can. But remember, ethics hours are required to be face-to-face. The telemental health hours, they could be online. Ethics has to be face-to-face. But remember, at least 25 of your hours for renewal has to be face-to-face, right? You could take as many hours as you would possibly like online. You could take 300 hours online, right? And meet your requirement of the 6 or 9 for telemental health rule online. But you still need those 25 hours at least face-to-face for your renewal. All right. What if in my graduate program we already covered telemental health counseling? I took a course on it in my master's program. Does that meet that requirement? It does not. You still need to take the 6 hours. What if I'm teaching a course on telemental health counseling, or I'm running a workshop on it? Then the rule, then what the board asks that you do is refer to the rules around that, around continuing education hours. So the board has a section on your CE requirements. If you're teaching a course or providing a workshop, so refer to that section specifically for that. Does the board only approve specific training providers, such as like the TeleMental Health Institute? No, the board does not approve. What you want to look for is the training approved by an association that you could actually utilize those hours towards your licensure renewal. So what do we mean by that? Well, if you're a counselor, what you're going to want to look for is like being approved by NBCC or being approved by LPCA. If you're a social worker, you're going to want to look for those hours to be approved by the National Association of Social Workers. If you're marriage and family, by the Association of Marriage and Family Therapists. So, like our training, the Telehealth Certification Institute, all of our trainings are approved by NBCC, also APA, American Psychological Association. Our courses are approved by the National Association of Social Workers, and our live trainings, what we do is we get those approved by the Association of Marriage and Family Therapy. So that's what you want to look for. Now, if I'm providing supervision via the phone or email or video conferencing, do I have to get these hours? Yes, you certainly do. That's what this is all about, right? What if a supervisor doesn't provide any supervision from a distance? They don't provide supervision by phone, email, and so forth. Do they still need these hours? Well, they do if their supervisees are providing services via electronic means, right? That's what we covered with why is it that the rule's there in the first place. And in terms of providing telesupervision, supervision from a distance, it's clear in the rule as of now that licensed professional counselors, the hours that they need for licensure in terms of supervision has to be face-to-face. The board is considering changing that, making some allotment for distance supervision. But as of now, for counselors, it has to be face-to-face. Not that you have to supervise face-to-face, but the hours that go towards licensure have to be face-to-face for counselors. That's not the case for social workers and marriage and family therapists. They can receive telesupervision. All right, so that clarifies the rule for you. If you have any other questions, please call me, right? I'm Ray Barrett. I'm a licensed professional counselor in Georgia. I've been practicing counseling in Georgia for, 8 or 9 years. And since day one, I've been providing telemental health counseling. And I do it in a variety of ways here in Georgia. I provide mental health and substance abuse assessments through video conferencing. I do phone sessions with clients in Georgia, video conferencing sessions with clients in Georgia. I'm very, very much involved with it. Let me tell you a little bit more about some advanced training. There's been really, really good training around for quite a while on distance counseling. And the best training is the credential in distance counseling. It's been around for, goodness, 9 years, something like that. It's called Distance Credentialed Counselor. It's provided by the Center of Credentialing and Education, which is the affiliate, the credentialing agency affiliate of the National Board of Certified Counselors. It's a fantastic credential. And there's 3 providers throughout the nation. And the telehealth certification, our company, our training institute, is one of the providers of the training required in order to become a distance credentialed counselor. It's really helpful because throughout Georgia, organizations, if they are not already providing services through electronic means, are in the process of developing that because it reduced cost drastically and it increases utilization drastically. Those that weren't able to get services met because of transportation issues, because of being homebound, because of economic issues or time constraints are now able to get services through electronic means. And they're able to get services when they need them, not having to wait weeks for an appointment so they don't end up in the hospital. It's very, very important. So organizations are aware of the credential and distance counseling because they don't want to be fined by HIPAA because of a violation of HIPAA's regulations. They don't want a violation of our codes of ethics. They want people that are competent in the use of technology working for them. And having this credential lets organizations know that, yes, you've been adequately trained. So our website, the Telehealth Certification Institute, where you may have gone to see this video in the first place, you can look at our training opportunities simply by hovering over the training tab or training button. We have live trainings, online trainings, and live interactive webinars. Now, if you want a training on site, on your location, or in your community, go to how to host a training. So you could co-host a training on site. We'd be glad to come out and do a training at your location. And the benefit of that is we could specifically address the questions that you have about your practice, your organization, in terms of the use of technology, policies, and procedures, which is extremely helpful. So you can give us a call about that. If you go to live trainings, you will see a list of courses. And the course that specifically meets the Georgia rule for the 6 hours is our Essentials course. So this Essentials course covers a lot. And here's a list of dates and locations of where you could take this training. As you see right now, we have a lot of live trainings come up. And you could see the agenda for the day, all the course objectives, information about the presenter, and the continuing education hours. For supervisors, for those 3 hours on telesupervision, we have a couple of those live events coming up. Now, I talked about the credential and distance counseling. If you want a full course, which is 15 hours long, again, the Essentials course is 7.5. 2 of those is ethics. The supervision class is 3 hours. 2 of those are ethics. And the DCC is 15 hours, and 4 of those are ethics. This course would qualify you to apply to become a distance credentialed counselor. We are, again, one of the approved providers for that. And it covers an incredible amount of competencies. We do not shy away from giving you every single thing you need to be competent in providing services. One thing I want to show you that's very important here, at least to me as a clinician, I've taken tons and tons and tons of trainings, and I get so frustrated when I'm given a bunch of information and then I'm still stuck wondering how is it that I actually implement this stuff, right? So one thing that I really one thing that's very, very important to me in providing trainings is demonstrations and allowing you to actually practice. So if you take one of our live trainings, bring your computer and let us know you want an opportunity to practice, and we'll give you that opportunity. And another thing is you could take a bunch of trainings, right? But then after you take the trainings, you're stuck trying to figure out how to create your legal forms, your clinical forms. So rather than having you struggle with that, we provide a whole bunch of sample clinical forms. I will show you that. If you go to the workbook, you will see what that encompasses. So if you take the training with the sample clinical forms, this is what you get. It's really, really amazing. because this providing telemental health therapy or providing counseling via electronic means could be really, really overwhelming for people, especially when you're not used to it. I don't know about you, but I didn't receive any training in my master's program how to do this in a compliant manner. So it could be extremely overwhelming, and I do not want people overwhelmed. Just like counseling, I want people to implement and to be successful, not to be more confused or overwhelmed. So with the workbook, you get a very detailed step-by-step process, how to set up your practice, how to do the intake process, how to have your first session, using all the different modalities, how to have your follow-up sessions, how to document, all that stuff. You also get a sample consent form, consent to treatment form, a group consent form, an assessment for fit form, a sample super bill, a form that you give your client that explains to them how to protect their own information, a form for yourself how to protect the client's information, a sample consent to unsecure electronic communication form, a sample up-to-date HIPAA form, all this stuff, right? And you need all this stuff. So, of course, these are sample forms, and you're going to want to adapt them for the purposes of your particular practice, right? And all the regulations around your specific practice. But this sample form makes it a whole lot easier to do. You're not starting from scratch. So these are the courses that we provide. And I want to give you actually a sneak peek. Because you're probably wondering, like, what does that actually look like, Ray? All right. So let's go to the full course. What this looks like, if you were signed up for this course, is it looks just like this. When you sign in, you go to your course, and this is what you get. Here's the course in the middle of the page. On the left-hand bar here, you see all the modules, and you have videos of each of the modules. The introduction, goals, why it's important, the benefits and drawbacks, research and history, modalities, when and where, which is great for marketing purposes and how to help people and reach them when they need it. Screening for fit. We're ethically obligated to do all of these things. We go over HIPAA in depth. There's a lot to cover in HIPAA, especially and also with legal and ethics and the consent form. How to use technology and how to choose technology. Practice management. How do you do it? An actual demonstration of how you do it. How do you have an emergency management plan? We need to protect our clients when we're providing services from a distance. And then demonstrations of how to do video conferencing and email and phone and chat and text, all of this stuff. And closure, how to work with couples and groups and message boards, cultural competencies, working with older adults, younger kids, hearing impaired, vision impaired, working internationally, how to serve facilities, which is a really large industry, and there's a great need for that. And then telesupervision, insurance and reimbursement, business setup. So after you take all this incredible stuff, you take the post-test, you take the evaluation online, and then you print off your certificate. And then if you want to apply for the credential, you submit that certificate along with your application. So that's what our courses look like online. It's very, very easy to use, very user-friendly. You could start it and come back to it as you wish. And as you see with me creating this video for you, we are accessible. If you ever have any questions, I love hearing questions, and I love helping clinicians that are really curious and really want to provide services in a competent way. That's very important to me. No question worries me. I love it. I love engagement. And I love working with alumni and hearing how they're implementing services and helping them become more and more compliant. It's always an ongoing process. I myself, I have a HIPAA consultant that I work with all the time. So I hope this has been very helpful for you in terms of filling in the blanks with what is the Georgia TeleMental Health Rule, what does it mean. So let me help you, and if you want to meet the new standard, again, go to our website, telementalhealthtraining.com. You could either take it online, live, or host a training right on site. So thanks again, and I really hope to hear from you. Bye-bye.